Typically, when we think of eating disorders, we think of females. We think of anorexic adolescent girls who starve themselves because they want to have the perfect body, or they don't really want to grow up. But in my practice, I have found that there are an extraordinary number of men who suffer from eating disorders. Typically, these eating disorders are bulimia, where men eat huge quantities of food and either exercise compulsively to get rid of the food, or they do some sort of self-induced vomiting to purge themselves of all the calories they consume. Treating male eating disorder is quite tricky because there is an enormous amount of shame and stigma attached to um, these sorts of things. Men feel that no one will understand them. They feel an enormous amount of shame for having what's typically viewed as a female disease, a female condition. It's very hard to get a patient to trust you with the incredible vulnerability that comes when they have to admit that they use food in a compulsive way. Some of the other challenges are the incredible denial and rationalization that occurs around all addictions. So a person will just deny the fact that they have an eating disorder. That when they binge on this food, it becomes this mindless process where something bigger, something larger just takes over them and forces them to eat compulsively. And then again, something just comes over them, or something just clicks, and they purge the food, and they become very detached from that experience, and they live in this place of denial around it. Or they rationalize it, or they say that, I go out with my buddies and I drink a lot of beer and I eat a pepperoni pizza, and then I go and I purge it out. So the challenges to treating male eating disorders are extraordinary. The good news, though, is that the recovery is extraordinary, and that once a person can admit that they have a disorder, the interventions, which is a fancy way of saying the tools that we use to treat them, are very effective. Typically, these tools involve addressing the underlying issue, which I've found exists in probably all of the cases that I've treated, whether that's a mood disorder, a depression, or an anxiety disorder, getting a handle on that, and then really exploring in the therapeutic trusting relationship exactly what's going on and why the person feels that utilizing this behavior is effective in their life. So the main object to dealing with male eating disorders is really getting past the shame and stigma and the misunderstanding that eating disorders are relegated to women only, that they're women-only diseases. But once those barriers are crossed, the recovery is remarkable and extraordinary.